Okay, regarding. So, hello guys. So, this is our final discussion. Congratulations. And I hope that you are studying well. Actually, this is a challenge for every one of us. Yung mga hindi self-motivated na learners, wala. Kailangan yung i-motivate ang sarili nyo. And today, guys, it's Good Friday today. And it's 10:30, so I'm recording this one and I'm thinking about you guys. So ito na ang last topic. So far, we've finished myelodysplastic syndrome, then leukemias, congrats. And finally, we have this erythrocytic disorders. Anong laman nito? So if you're going to bring out your notes, it's anemia. Plus, medyo mahaba-haba yan. But I want to break it down and focus. Yan, tinignan ko yung mga review notes ko kung ano yung mga in-emphasize nila at yun ang i-emphasize natin today. Okay? So, it will be, I based the flow of my PowerPoint based on your notes. So, get your notes, ganyan. However, I added a little bit things. Medyo nag-modify lang na iba, pero it's all the same. Yeah. So, are you ready? So, grab your notes. So, if I'm going too fast, this is 40 slides. For that anemia, actually 12 pages yan. So, sinamarize ko. Plus, sinamarize ko mas lalo na yung hemolytic anemias. Okay? So, let's move on. Yan. I know it. Yun na yun. Yan. And so, I can't resist to place that plug. So, guys, anemia. So, unlike leukemia, most of anemia is decreased. Yan. So, group of clinical conditions or clinical disorders which will show decreased red blood cells and decreased hemoglobin and hematocrit concentration. So, class, I need you to review for my Hemo 2 class. I need you to review. Yan, yung mga hemoglobin, hematocrit, red blood cells, because this included in your board exam. So this is a group of clinical conditions. Nako, marami-rami. And all of them, if once you look at your peripheral blood smear, dapat automatic decrease ang hemoglobin and hematocrit. And even the red blood cells. What are the causes of anemia? So I tried to give other examples. So genetic factors, maturation defects, and production defects. So there's something wrong with the erythropoiesis. There's something wrong with the differentiation, diba? Differentiation means the maturation of your cells. So there can be example, pag deficient of vitamin B12. So there's something wrong with DNA synthesis. Yan. So there is asynchronous maturation. What else? We have environmental factors. Nag-add lang ako, class. You don't have to write this one. Medyo matindi lang yun nilagay ko. Sabi niya, alam niyo, class, deficiency in iron, yan, isa developing country problem. Hindi yan problema ng mga first world countries. So, yan, nutrition. Example, poverty. Diba? Poverty increases your risk to becoming more sick. What else? Social status, class, on where you work. Example, itong this person works on on an area where they work with lead. Yeah, you can be exposed to lead poisoning. So, accidents, class, which can cause bleeding. Pathological factors, yung mga underlying diseases. Example, ang mga pag-uusapan natin dito, ito, in relation to parasites, hookworm, Necator americanus, ganyan, and Diphyllobothrium latum, pag megaloblastic anemia. Chronic diseases apparently can cause anemia. What else? Iatrogenic anemia. Iatrogenic means physician caused. Yeah, physician caused actually. So example, getting too much blood from a baby. What else? From blood transfusion. Plus, blood transfusion actually is very helpful. However, you can get antigens that are coming from other people which can attack your red blood cells. What else? total gastrectomy or gastric bypass, the removal of a portion, removal of your gastric system or a removal of a part in your digestive system. Siyempre, yun yung mga site of absorption. So there's pag natanggal yun, we will lose important parts for absorption. Yan. And chemotherapy, plus ang maraming side effects ng chemotherapy. Yan. Ganda rin, plus maganda rin daw anemia to. So you have to differentiate, actually, nasa notes nyo naman, diba, between absolute and relative anemia. Pero just a review, isn't it that we also discussed the difference between absolute versus relative polycythemia vera? Pag sinabi nating absolute anemia, there is real, there is true decrease of the red cell mass. Yan, talagang totoo. Bumaba yung red cell mass natin. In relative anemia, your red cell mass looks low, mukha siyang bumaba, since it's relative to the plasma. Tama ba? Di ba parang pag nagbabasa ng hematocrit, we take note of the plasma as well. Kasama yun sa measurement natin. So class, pag mukhang marami yung plasma, nagmumukhang mababa yung red cells. So example, what are the causes of relative anemia? Overhydration. Yan. Transfusion of plasma. Yan. In absolute polycythemia, there is real increase or decrease of red cell mass. Increase, diba? Yan. So, yan. Real, there is true talaga. Tumaas talaga yung red cell mass. Yan. Perhaps due to increased precursors, diba? And what else? Relative polycythemia vera. So relative because it may be due to the plasma. So relative, there is mukhang tumaas lang yung red cell kasi bumaba yung plasma. Example, in dehydration among burnt patients, gano'n. Naintindihan? Yes. Pagbabalik ng polycythemia vera saka anemia, ha? So, clinical signs, class. This clinical signs, pakitandaan to. This will be common in all of your, almost all of them will be common. Yung mga ipo-point out ko, yung mga i-annotate ko, yun yung common sa lahat ng anemia. Automatic yun na example, ito, fatigue, dizziness. Yan. Fatigue, dizziness is found in your anemia. What else? Paleness, coldness, since we have low red blood cell, muscular weakness, and class in the starting development of your anemia, siguro yun muna. Pero as we go on, class, it's very common na rin yung mga palpitations, rapid heart rate, because the body is compensating for the need of more blood, of more red cells, palpitation, chest pain, angina, class, worse na, dapat hindi ko pinahunan yung heart attack. Siguro hanggang angina, there are heart murmurs, yan, there are pain in the chest, yan. And ayun, tapos class, itong mga low blood pressure, yellowing, jaundice na, this can be from hemolytic anemia if there is excessive breakdown of your red blood cells, if there is premature lysis of your red blood cells in cases of hemolytic anemia. Mag-yellow ka na. There is the release of red blood cells there's the release of red blood cells in the circulation, tapos it will be converted to unconjugated bilirubin, tapos conjugated bilirubin, di ba? Tapos stercobilin dyan. So there can be bleeding in your urine, hemoglobinuria, or change in stool color, pwedeng black, pwede red in color. And more black pag hemolytic anemia. Shortness of breath. Ayan. So, class, ganyan katindi ang anemia. And class, vitamin B12, ang or megaloblastic anemia, isa sa parang key characteristic niya is neurological symptoms. Doon mo lang makikita yon na anemia sa physical symptoms in vitamin B12 deficiency. And clear all my drawings. Next na tayo. Ayan, syempre, nag-weakness, diba? Paano mag-next? Dapat kasi inano tong annotate bar. Okay, next. Yeah. So, laboratory diagnosis class, dito tayo mag-focus. So, hemoglobin hematocrit, increase, decrease, diba? Decrease, syempre, anemia. RBC indices. Now, this RBC indices will be very important, especially in the morphology of our anemia. So, please paka-review. Pag sinasabi natin MCV, this is the one which will, the volume, mean corpuscular volume, this is the one which will dictate the size. Yan. So, pag more than 100 femtoliters, expect that the sizes of your red blood cells are macrocytes. Yan. If it's less than 80 femtoliter, then these are microcytes. In our MCHC, so hemoglobin concentration, mean corpuscular hemoglobin concentration, actually meron pa tayong MCH, pero dito na tayo mag-focus MCHC. So it's about 32 to 36%, or pwedeng gram per DL yung unit. So more than 36% is hyperchromic, which is very rare. We can only see it in spherocytes, and 32%, so less than 30%, is hypochromic. Yan, hypochromic. So less yung hemoglobin concentration niya. So MCHC, it talks about the hemoglobin concentration. MCV, it talks about the size. Yan. So kung it's within normal range, so MCV, it's normocytic. So normal yung size. And MCHC is normochromic. Pag normal yung hemoglobin concentration. Next class, let's talk about RDW, or red blood cell distribution width. So the RDW is very important because it will tell if there are variety, sabihin natin, or variations in the sizes kung may anisocytosis. So we can say that it is a sign of anisocytosis. So if it is increase, ibig sabihin there are dimorphic, ibig sabihin there are different sizes that are found in your blood sample. So, pag increase siya, ibig sabihin, not only hindi lang may normocytic, may macrocytic, ganun, iba-iba yung mga sizes. Ganun. RDW is a sign of anisocytosis. So, if it's increased, there is anisocytosis, or it's a dimorphic population. Kasi natanong yan sa board exam. Yan, mahilig sila magganyan. So, reticulocyte count. So, the normal lang dapat na lumalabas ng reticulocyte count is 1 to 1.5%. Ibig sabihin, about maximum 3 in a peripheral blood smear. So anything more than that, it can be a stress reticulocyte, meaning the body is trying to compensate the decreased amount of red blood cell. That's why it's prematurely releasing baby red blood cells. Ibig sabihin, hindi pa mature yung masyadong mature yung mga red blood cells, since there is an increased need, may high demand, guys, nilalabas ng mga baby pa lang, which is reticulocyte. So, high amounts which can lead up to 5%, 6%, ganyan, can be a sign of stress reticulocytes, or it's a compensatory mechanism. Yan. Gusto ko yung iguana, class, para hindi nyo makalimutan tong slide na to. Reticulocyte production index. Sometimes they talk about this. So I give you, binibigyan ko na kayo ng mga signales. So pag siya, less than 2, it's hypoproliferation. Ayan. Ibig sabihin masyadong mabagal. If it's greater than 2, hyperproliferation. Sabi niya, may excess production of your red blood cells. Since andito tayo sa anemia, most of the time, they have hypoproliferation. Decrease ang RPI. And class, myeloid erythroid ratio. So, huwag nakakalimutan to, promise, lumalabas to sa board exam. So, the normal is 3 to 4:1. Dapat mas marami ang myeloid progenitors kumpara sa erythroid progenitors. Ang ibig sabihin nito, in every 3 progenitors, dapat merong isa lang na erythroid progenitors. Ba't gano'n? 'Di ba sa circulation mas maraming red blood cells, ganyan. 3 to 4, dapat mas maraming myeloid progenitors, guys, because they have shorter lifespans. Yan. So, mas unti ang erythroid progenitors because in their literal number, they can multiply in mas maraming, I think 16 in every normoblast ang lumalabas sa ang 16 red blood cells in one normoblast. Don't take my word for it, pero parang ganon. So, yun. And red blood cells tend to have longer lifespan. Myeloid, mga granulocytes, pwedeng 24 hours or less. Compensatory mechanism. So, I need to talk about this, guys, because your body, so if there's anemia, it does not give up. Sabi niya, ay, may anemia na ako, tapos na ako. Hindi. Of course, it has ways to adjust, to adapt, di ba? Our body is always undergoing, ano yun? Homeostasis, kasi hemostasis yung nasa isip ko yan. Homeostasis. It always wants to equilibrate itself or balance itself out. So, ibig sabihin, class, may anemia, mag-a-adjust naman yung katawan. So, here are its adjustment. So, number 1, example dito, hematologic response, it will increase its EPO, erythropoietin. So, the kidneys, the peritubular cells in the kidneys will produce more EPO if it sense that there is decreased red blood cells. Pero example, class, if we have refractory anemia means it's unresponsive. It's unresponsive to EPO therapy. Yan, pag refractory anemia, it's unresponsive to EPO. So, problema yon. But, however, in normal case is class, your body tends to increase your EPO if there is, example, hypoxia. Yan. What are the other responses? The oxygen dissociation curve will tend to shift to the right. Paano ba mag-shift to the right? So, example, it will produce more 2,3-DPG because 2,3-DPG will release more, will facilitate the release or the delivery of more oxygen. And so it will shift it to the right. What else? Redistribution of blood flow. So, class, ang galing ng katawan. Where the blood is mostly needed, siyempre, sa internal organs natin, mas lalo na dito sa gitna. So, that is where the blood will concentrate. Ayan. So, and increased cardiac output. That's why one of the symptoms in anemia is palpitations, shortness of breath, heart murmur, because the body is trying to adjust. And to compensate for the loss, kailangan the heart should work harder to pump more blood out. Yan. Yan yun. Yan ang katawan. Okay. So, classifications of anemia. Yan. So, first off, first two, yan, hindi na mag-focus dito. So, physiological classification. So, if there is based on ineffective erythropoiesis or effective erythropoiesis. Next, etiological, yung source. Number 1, if it's relative, it's not really decreased amount of anemia. Number 2, anemia secondary to blood loss due to losing blood. Anemia associated with defective hemoglobin synthesis, B12, impaired bone marrow, decreased red cell survival. Yan, example, hemolytic anemia. So, those are the etiological and physiological classification. Pero class, ang mag-focus tayo dito, so I made a table for you. So, classifications of anemia. So, this could be your guide. So, example, class, in microcytic hypochromic anemia, so microcytic and hypochromic, so expect class, the MCV is less than 80 femtoliter. At yung MCH, kaya hypochromic, less than 32. So class, gumawa ako ng mnemonic na it's not, hindi ako gumawa nito. Nakuha ko lang rin sa iba. Tails. So, wag niyo kakalimutan 'to, thalassemia, anemia of chronic disease, iron deficiency anemia, lead poisoning, and sideroblastic anemia. Class, there are talks na yung example, anemia of chronic disease, pwede siyang normocytic, normochromic, ganyan. Pero dito na lang tayo para hindi kayo malito, basic lang naman eh. Yan ha, tails, huwag niyo kakalimutan. Next, macrocytic and normochromic. So, sa discussion ko, mag-focus ako sa vitamin B12 deficiency and pernicious anemia, but note kasama rin ang folic acid. So, meron rin tayong mga non-megaloblastic anemia, but let's not focus on that. Next, normocytic, normochromic. So, normal ang MCV and MCHC. So, I will focus on hemolytic anemia. Yan. So, ito, mga may bleeding, you expect increased reticulocytes. Pero class, iniba ko yung classification nila. Ayan, mamaya you will see it. So let's start with your macrocytic and hypochromic anemia. And the most common one is iron deficiency anemia. So let's just take a look at this photo. So notice the red blood cells. So masyadong malaki yung color nila, yung white in the middle, di ba? Dapat normally it should be less than 1/3 of the red blood cell. Dapat maliit lang yan. So ngayon, nagmukha na siyang onion rings, guys. It's more than 1/3. It's more than 1/2 of the cell. So, magsimula na tayo sa iron deficiency anemia class. So, meron sa notes nyo na table. Yan. So, ferrous iron is the one that is iron, that is the one that is readily absorbable. So, kailangan niya ng mga assistants to increase it's being absorbed in the body. So, kailangan niya ng vitamin C at saka hydrochloric acid. So, hydrochloric acid class mahalaga in cases of iron. So, example, if there is decreased hydrochloric acid in the body, hindi ma-absorb completely ang iron. And ironically class, ang ferrous iron, pag na-absorb siya, i-convert rin siya ng katawan ng ferric iron. Ganyan. Tapos now, through methemoglobin reductase pathway, now it will reduce iron ulit to ferrous. Yan. Anyway, yan na yun. Next, the causes. Ito tayo mag-focus. Sa notes nyo, I group them into 3. So, increase in demand for iron. Diba? Ano pa ang cases na tumataas ang demand ng iron in growing children? Ayan. Among pregnant women, mas lalo na pag naglalactate sila. In lactation as well, I mean, sa pregnancy, nang buntis sila at saka nung napanganak na nila at nagpapagatas na sila, they have higher demand for iron. Yan, diba? Basic. Next, what are the cases wherein there is increase in iron loss? Nawawala yung iron. Siyempre, number 1, bleeding. Yan. So, in cases of hemolytic anemia, intravascular hemolysis, meaning there is premature breakdown of your red blood cells in hemolytic anemia. And number 1, blood loss. In the developing world, this is the most common cause is chronic blood loss. So example, people who have peptic ulcer disease. So when we say peptic ulcer disease, diba, there are lesions in the stomach and it has caused bleeding. So ganon. So they are losing blood for a very long time. They didn't even know. What else? Cancer, especially in the colon, in the stomach, ganyan, nag-lose na pala silang blood. And hookworm, yes, ganyan, hookworm. So, meron dyan, sa hookworm, so how much blood do they get from the humans per day, ganyan. So, pang board exam nyo na yan, hindi ko nagtatanong yan. But hookworm, wag nyo kakalimutan, ha? And next is decreased iron supply. So ang pinaka-common dito is malabsorption. Though people, it's heme iron, kunyari kumakain sila ng mga laman loob, ganyan, meat. However, they have malabsorption, then the iron that they ate has no use kasi hindi naman pala nila na-absorb in cases of celiac disease. Yan, celiac disease or sprue, S-P-R-U-E. I think it's in your notes. So, class, alam ko itong mga celiac disease. Sila yung mga gluten sensitive. Ayan, gluten sensitive. So, kaya maraming food na gluten free. I thought it was just a hype. Pero ewan, huwag na natin, pakialaman. But yun, some people have celiac disease. And what else? Post-gastric surgery. So, people who had their stomach removed, ganyan yung mga pampapayat. We don't know it. It can be for aesthetic purposes or it can be for their health purposes, ganyan. So, anemia, iron is absorbed in the stomach. So, if there's no stomach anymore, then iron cannot be absorbed. So, poor diet in the third world country and frequent blood donation. So, that's not common. So class, can we just review? So your hemoglobin is made up of heme and globin. Heme and globin, di ba? So heme, yan. Now heme is made up of protoporphyrin, 9, and iron. So, to attach iron to protoporphyrin, di ba kailangan ng ferrochelatase enzyme? So, yan, magkakasama yan. So, your globin is the protein portion of your red blood cell. So, we have alpha globin and beta globin. So, if iron is affected, guys, so we are talking about if iron is affected, then we're talking about iron deficiency. And if protoporphyrin is affected, it can be due to porphyria, pwede ring sideroblastic anemia. And if the alpha and beta globins are affected, if we're talking about thalassemia. Ganyan. So class, in cases of iron deficiency, mababa ang iron. So expect, syempre, na mababa rin ang heme. Yan. So class, if the body tends to compensate again, so pag mababa ang iron, bumaba rin ang heme, plus tumataas ang protoporphyrin. So later, we will have a pre-erythrocyte protoporphyrin. And in cases of iron deficiency anemia, expect it to increase. Yan. So mamaya, sa sideroblastic anemia, mataas ang protoporphyrin, mababa ang iron. Ay, mataas ang iron, mababang protoporphyrin. Okay. Class, can we just have a review? Ma'am, bakit ang laki ng impact ng iron? You said that iron deficiency anemia will result to a macrocytic hypochromic anemia. Ibig sabihin, lumiliit yung red blood cell. Isn't it that tama, diba? Upon the maturation of your red blood cell, so it decreases in the cell size. Yan. Tapos sabi, microcytic, so mas liliit pa ng liliit, less than 6 micrometers. It happened, plus your red blood cell tends to stop maturing once iron attaches to protoporphyrin. It will stop on decreasing size once iron attaches to protoporphyrin. And since there is iron deficiency, and there is no iron that will attach to protoporphyrin, and the cell keeps on dividing. And the cell keeps on maturing. Yan. Kaya lumiliit siya lalo. So, because there is no iron to be found. Yan. And class, bakit? So, that's why it's microcytic. So, microcytic, it keeps on dividing because there is no iron to attach to protoporphyrin. And class, there is decreased hemoglobin because there is decreased heme. Yan. Iron is an important precursor to create hemoglobin. Okay. So, in iron metabolism, so iron are absorbed in the mucosal cells. And iron, so pwedeng makakuha ng iron from the diet and pwedeng makakuha ng iron from the recycling, from the breakdown of erythrocytes. Yun yung number 2. galing ng katawan, class. It has the ability to recycle what is important. Class, hindi lang iron ang nire-recycle ng erythrocytes, pati globin, yung mga amino acid found in the globin. Ang galing, no? I love it. Ayan. So, once iron from the breakdown of erythrocytes, it can be transported in the plasma by transferrin. Ayan. Ayan. So, the iron is carried by transferrin. Ayan. So, and plus your transferrin can carry it to the bone marrow, spleen, tapos it will be stored as ferritin. So, kung ang glucose, it's storage form, ano tawag? Glycogen. Diba? So, pag ang iron na store, it is called ferritin. And if it's the iron that are found in the macrophages, we call it hemosiderin. Yan. So, ayan. So class, we have stages in the development of iron deficiency anemia. Here, I just want to emphasize na mga kapatid, hindi basta-basta the transition of iron deficiency anemia does not happen in one click. Ganyan. Sabi niya, Rome did not fall in a day. Yan. So it took a while for it to fall. So same thing with iron deficiency anemia. Iron deficiency can happen in a very long time. It's a process. So first, so may 3 stages tayo. Sabi niya, iron depletion stage. So basically the depletion of iron stores. So dito sa stage na to, mataas pa ang iron because we have a lot of stored iron in the form of ferritin. However, in iron depletion stage, the ferritin are starting to decrease. Yan. Normocytic, normochromic pa tayo dyan. Siyempre, kasi may mga iron pa naman in the circulation. And next, we have iron deficient erythropoiesis. So now, there's a problem because now the ferritin stores are almost gone and now the iron in the circulation are also decreasing. And finally, class, iron deficiency anemia. Now, we can really see that there is microcytic and hypochromic cells due to the decreased amount of red blood cells and expect still a high RDW. So, ibig sabihin may mga normocytic na cells pa. Okay, now let's go to the symptoms that are aside from weakness, fatigues, angina, murmurs, ganon, shortness of breath. So these are the other symptoms that are very unique with your iron deficiency anemia. So unahin natin yung koilonychia class. Spoon nails yan. Ewan ko na yung isip ko. Baka gutom na ako nung ginagawa ko tong PowerPoint kahapon. So, koilonychia class, it's where the nails become spoon-shaped. So, look at your nails class. Yan. Baka naglalang kayo ng iron deficiency. Ganyan. So, koilonychia, spoon nails. Yan. So, next class is Plummer-Benson syndrome. Yan. Wala yan sa notes nyo. Gusto ko lang idagnag. Kasi class, Plummer-Benson syndrome, when we say syndrome, it's a group of symptoms. Ang laman ng Plummer-Benson syndrome, may iron deficiency anemia, dysphagia, difficulty of swallowing, and esophageal webs. Di ba yun yung meron sa sa notes nyo? Esophageal webs, esophageal webs. Yan. Esophageal webs, whatever. So, ito, kumuha ko ng pinaka-OA na photo na webs na makikita ko. Actually, some photos, you can't even see the webs. But this one, you can really see the mucosal extension. Parang nag-extend yung mucosa. Yan. Dapat wala naman ganyan. Dapat it should be smooth type of tube. However, due to esophageal webs, and meron ganyan. So, it can also be a Plummer-Benson syndrome. So, pag narinig niyo yung Plummer-Benson syndrome, it's iron deficiency anemia. Next class, pica. So, cravings for non-food items. So, look at this guy, guys. So, kumakain siya ng bato. So, yan, usually, kids, di ba, kung ano-anong kinakain. But it can also be a symptom, yan, of iron deficiency anemia kung ano-anong kinakain. We have this glossitis. So I think in your notes is there's something inflammation in the tongue, ganyan, glossitis. Let's tong photo na to, it's not glossitis. Yan, ito ang glossitis. So inflammation of your tongue and cheilitis class, yung nasa notes nyo is breakage in the epithelium of the skin around the mouth. Ayan. So, yan, Koilonychia, Plummer-Benson syndrome, or esophageal webs, pica, glossitis, and colitis. Yan. Ayos ba? Class, Koilonychia. So, iron deficiency anemia. Cute, no? Galing, ang interesting ng mga symptoms. Yan. So, now, let's talk about laboratory diagnosis. So, ang pinaka-naiba dito, now, we have other diagnostic tests, which is iron studies. And notice, bone marrow biopsy is not common in anemia. So, sa leukemia yan common. So, first, we have complete blood count. Siyempre, ano bang expect nyo, guys? So, from hemoglobin and hematocrit, and TP, MCH, the indices, class, reticulocyte, decreased. And decreased production. Yan, reticulocyte will only be increased if there is bleeding. Yan, bleeding dito. And class reticulocyte, how can you make baby red blood cells if you don't have the enough materials to make it, diba? Kaya decrease din ang reticulocyte. RDW, increase. Yan. Next class. Serum iron, sorry. Serum iron, increase, decrease. Siyempre, decrease. Stored iron, decrease. Percent saturation of your total iron binding capacity. So TIBC is a way of measuring the amount of your transferrin or your iron carriers. Yung percent saturation class, kumbaga, your transferrin is your jeepney or your TIBC is your jeepney, jeep yan. So what we're counting in TIBC is the amount of jeepneys. In percent saturation of TIBC, we are counting the spaces inside the jeep. And kung ilan yung allowable space inside the jeep. And apparently in percent saturation, since we don't have enough iron anymore, its capacity decreases. And but since there's nobody to ride, it is increased TIBC, class, diba? Free erythroprotoporphyrin. Once iron is decreased, protoporphyrin will increase. Yan. And soluble transferrin receptor, STFR. So, baka lumabas lang sa board. So, increase rin siya. Pakilagay sa notes nyo sa last ng microcytic and hypochromic anemia. There's a table there. So next, microcytic hypochromic anemia with regards to sideroblastic anemia. Yeah. So sideroblastic anemia, there is an increased deposit of iron in the mitochondria of red blood cells due to the defect in protoporphyrin synthesis. So, class, mababa yung protoporphyrin natin, mababa rin yung heme, and with that, it tends to accumulate more iron. Yan. Due to the problem of protoporphyrin, there is accumulation of iron. Ba't ganon? Eh di saan kakapit yung iron? Saan pupunta? Kakalat sa class. Mamaya I'll show you. So, class, the iron deposits in the mitochondria of your red blood cells or your normoblasts. Then iron deposits. So when we say sideroblastic, so sidero means iron or constellation, and blastic means immature cells. So the immature cells deposits iron as well. Dito naman tayo. So in sideroblastic anemia, expect hypochromic, ayan, red blood cell. So, increase RDW rin to kasi iba-iba yung population. So, next, Pappenheimer bodies or siderotic granules. Isn't it your Pappenheimer bodies? Inside it are iron. Yan. So, it's good to stain it with pearls, Prussian blue stain. And mas lalo na to, it is our ringed sideroblast. Yan, ringed sideroblast. So, I told you guys, iron has nowhere to attach to. Kaya they deposit in the mitochondria. Ganyan. So, it's forming a constellation around the nucleus of the immature blast cell. Tingnan. Yan tayo. So we have, I summarize it into three short classifications. We have hereditary sideroblastic anemia due to the defect on Diala synthase. So there's something wrong with the creation of heme. Class protoporphyrin is an important part of heme. So may mali sa Diala synthase when it's hereditary or yun, congenital siya. Next, ito, class sa MDS natin. We have RARS, refractory anemia with ring sideroblast. So this is very unique refractory anemia because this is the only time that you will see sideroblast. So it is pre-leukemia. Pero it has good prognosis. Yan. It is less likely to become acute myeloid leukemia. It is the most common one to see sideroblastic anemia. And class, ito, there's something wrong with your D-allosyntase para madaling maalala. At since it's an MDS, we have Pelger-Hewitt WBCs or hyposegmented WBCs since it's an MDS. Diba? Parang there's something wrong with erythropoiesis, there's something wrong with granulopoiesis. Next, defective heme synthesis. Yan. So the common cause of, so aside from the absence of D-allosyntase, class ang heme, binubuo siya sa mitochondria. So kung nasira na ang mitochondria dahil sa alcoholism, so yan. So it can result to sideroblastic anemia. Class lead poisoning. So there's a defect in ALA dehydrase and ferrochelatase. So how can you properly create your protoporphyrin and iron, diba? And class, ito, tuberculosis drug or isoniazid. Pakisulat sa notes. So it inactivates vitamin B6. Vitamin B6 is an important cofactor in your heme synthesis. And of course, if there is vitamin B6 deficiency. Yan. Plus, short lang tong sideroblastic anemia. Clear all my drawings. Clear all drawings. Yan. And next. So, yan. So, nakalimutan, Pappenheimer, ring sideroblast. So, laboratory diagnosis. So, hemoglobin, hematocrit, MCV, expected to decrease, RDW increase, PBS class. Siyempre, microcytic, hypochromic. Serum iron class, ferritin, and percent saturation of PIBC are all increased except PIBC. So class, serum iron is increased, the same. So sideroblastic anemia has the same symptoms with hemochromatosis. Nasa notes yung ang hemochromatosis. Pakibasa nila. We have the stored iron are increased. Diba? Because it has nowhere to attach to. Percent saturation is also increased because of the increased iron and decreased PIBC. Yan, decreased carriers. They're saying that indirectly proportional ang percent saturation and PIBC. Next is thalassemia. So, class ito, the image here. So, bossing. Yan, I think nasa notes nyo yun sa harap. Bossing of skull and maxilla in beta thalassemia. So, parang chipmunk appearance daw. So, here. So, parang sa, class, ano na yung sakit na yun? Burkitt's leukemia. Mayroon silang mass in the mandibles among African children. Thalassemia, class, there's something wrong with the quantitative defect on the globin chains. There's something wrong with the globin chains. So, it's a major thalassemia. So, actually, it's classified into alpha thalassemia and beta thalassemia. Alpha thalassemia if the alpha globins are affected. Beta thalassemia if the beta beings are affected. So under them, we have either major thalassemia or minor. So what in the class pag major thalassemia, it can lead to hemolytic anemia, premature breakdown of your red blood cells. But if there's minor thalassemia, it's be hypochromic. I think yung friend ko, ano lang, minor thalassemia lang. But she was needing a blood transfusion every now and then. So class, sinamarize ko na siya. So alpha thalassemia, we have four. We have Bart's hydrops fetalis. So name pa lang parang scary na sa mga children. So Bart's hydrops fetalis is an alpha thalassemia which will result for the baby being stillborn. Yan, hindi siyang bubuhay outside the womb. So this can happen if there is the complete absence of alpha thalassemia. So, syempre, hindi na natin madadiagnose yung stillborn sa baby. Hindi natin siya madadiagnose. Pero, ayun, being a stillborn or nakunan yung mom, we can pertain it to alpha thalassemia. Next, hemoglobin H. Class, it has pitted golf ball appearance. Yun yung key characteristics ng hemoglobin H. And it is the fastest in electrophoresis. Yan. When we had a reviewer, sabi niya H as in hagibis. Mabilis daw. And we have minor and silent carrier. Next class, beta thalassemia. We have major. So, pag narinig niyo yung Cooley's anemia, so that's beta thalassemia. And we have Cooley's straight and intermedia. So, major Cooley anemia can lead to hemolytic anemia. So, in your notes, I think there is parang mongoloid appearance. Siguro yun yung bossing of the maxilla or chipmunk appearance. Yan, Cooley's anemia. Next class, bilis no. We have anemia of chronic disease. So apparently, class, you can get anemia if you have chronic inflammation, ganyan mga cancer, tuberculosis. It can lead to anemia, autoimmune disorders. Why? Because in cases of this anemia, there are lots of cytokines which are produced. So these cytokines are trying to kill all the bacteria. Pero apparently, may side effects sila. Sabi niya, iron is utilized by bacteria and trapped among the macrophages. So iron is utilized and siguro ito yung keyword sa anemia of chronic disease. Iron is trapped in the macrophages. It is not released. So example, there is red blood cell breakdown. Yan, nag-breakdown yung red blood cell at lumabas yung mga iron. So the macrophages tend to engulf the iron for recycling. However, ayaw nilang ilabas. Why? Because example of cytokines, class, we have IL-10, tumor necrosis factor, and interferon do not release the iron from the macrophages. Class IL-10, tumor necrosis factor, and interferon are high. Tumataas sila if there is inflammation. Yan. So apparently their side effect is it will not allow the release of iron because iron iron is also a sustenance for bacteria. And what else? This IL-6 class, in your notes, merong word na hepcidin dyan. So, hepcidin promote, sabi niya, IL-6 increases hepcidin. Your hepcidin blocks the absorption of iron. So, masama ang presence ng hepcidin. In cases of iron deficiency or anemia of chronic disease. So, the treatment is a hepcidin antagonist. Galing mo. Para pigilan yung hepcidin. Pakisulat na lang to sa notes nyo, guys. So, annotate, clear all my domains. Clear all domains. Yan. So, class, in your anemia of chronic disease, so decrease po hemoglobin hematocrit, iron, because it's trapped. Yan, sinulat ko na para sa inyo. Picturean nyo na lang. TIBC, is also decreased and percent transferrin saturation is decreased. However, class, increased ang ferritin because it's stored, diba? And once iron is trapped, tumataas ang free erythrocyte protoporphyrin. And class ferritin is high because of high iron stores. And class, ang ferritin rin kasi is an acute phase reactant. Tumataas ang ferritin pag may inflammation because of IL-6. So aside from FC din, ang pinapataas ng IL-6, also ferritin. Yan. So class, to differentiate iron deficiency anemia from anemia of chronic disease, look at the ferritin. Yan. Ang ferritin sa iron deficiency anemia, mababa siya. Mababa ang stored iron. Pero pag anemia of chronic disease, mataas siya because it's also an acute phase reactant. Galing, no? Now, ang bilis natin. So we have macrocytic normochromic anemia. So I want to take a break first. Yan. Mag-stretch muna ako, class. Wait. Okay. Let's start, guys, with your macrocytic normochromic anemia. So here in this image, you'll notice, observe nga natin, that it's normochromic kasi we can still see the pallor. Yan, mukhang buo pa yung pallor, but it's bigger. Yan, macrocytic red cells. So expect the MTV is more than 100 femtoliters. So class, I think I narrowed down my discussion to megaloblastic anemia. So I want you to focus on this one. So its characteristics. So your cells becomes bigger. Why? Because of abnormal DNA synthesis. So abnormal DNA synthesis resulting to asynchronous maturation. So there's something wrong with the DNA synthesis. Why? Because vitamin B12 class and folic acids are important precursors in creating your DNA. Para gumawa ng DNA class, kailangan ang vitamin B12. Yan, vitamin B12 is important in making thymine. So, naalala nyo yung mga bases, yung site, adenosine, cytosine, thymidine, yung gano'n. So, ayun, kailangan sila sa thymine. Yan. So, ba't malaki? Yan. Ba't malaki? So, there is asynchronous maturation. So, normally, the maturation, ang normal, di ba? Dapat lumiliit. But since there's abnormality in its maturation, it becomes big. Yan. It doesn't, there's, it is slower in its maturation. Mabagal na maliit, malaki pa eh. Yan. So class, what are the distinct blood picture when we are talking about megaloblastic anemia? So under megaloblastic anemia, we have pernicious anemia, we have vitamin B12 deficiency, and folic acid deficiency. Yung tatlong yun na. So meron tayong macrocytes. Yan, dito sa unang picture na to, macrocytes, ovalocytes, and pancytopenia. Ang hindi ko na-label, yung hypersegmented neutrophils class. So, macrocytes, ovalocytes, expect pancytopenia. What else? Expect Howell-Jolly bodies class. The inclusion inside your Howell-Jolly bodies class, it's DNA. Inside it is DNA. And the only time that you can detect its DNA if it's Fulgen stain positive. Yan. And class, basophilic stippling. Kasi class, it doesn't only affect, kasi DNA ito eh. So, even the creation of RNA is affected. So, merong konting basophilic stippling, but it's rare, ha? So, ang gusto ko i-memorize nyo, macrocytes, hypersegmented, neutrophils, Howell-Jolly bodies, and Fulgen stain. Positive ang Howell-Jolly, ah. So, class, so ang Howell-Jolly class, di siya DNA synthesis, ha? So, ang nasa loob niya, DNA. Yan. So, ang cute ng dimple na yan, dimple, mukhang dimple, DNA. Ang naman yan. Okay. So, vitamin B12 and are cobalamin deficiency. So, my discussion is framed here. Yan, ito tayo. So, vitamin B12 is important as a precursor for the synthesis of DNA. Class, siya lang ang may neurological symptoms. Ma'am, what are the neurological symptoms? There can be the loss of memory, reflexes, pwede ring psychosis. Kasi ganun katindi. Sino nagkakaroon ng vitamin B12 deficiency? Those who are strict vegetarians. Class, yung teacher nyo, nagmagaling, nag-vegetarian ako for 1 year. Ayan, totoo, class. Talagang vegetables lang. Next, we have impaired absorption. So, I divided it into 2 lang. Yan. Kasi, napansin ko sa notes, parang absorption na naman. There's something wrong with the absorption. So, even though you have adequate intake of vitamin B12, but there's something wrong here eh. In the gastric area where vitamin B12 is supposed to be produced. Yan. Wait lang. Ano bang kailangan? So, kung si iron is carried by transferrin, the partner in crime of vitamin B12 is transcobalamin, class transcobalamin 2, yun ang kailangan niyang transporter. So, if something attacks your transcobalamin, yan, nako, there's something wrong. What else? Intrinsic factor. So, intrinsic factor is kung ang intrinsic factor, it allows the absorption of vitamin B12. So, example, in ferrous iron, you need hydrochloric acid or vitamin C for it to be absorbed. So, kung wala rin yung intrinsic factor, nalagot ka na. So, ganun. Yan, start na natin. Number 1 is Crohn's disease. Yan. So, in Crohn's disease, mas malalim pa yung sakit dito. But its effect to vitamin B12, it does not, there's something wrong with enterocells and class, the vitamin B12 cannot bind to transcobalamin. So, yung disease sa Crohn's disease, ang effect na class, it cannot bind to transcobalamin transporter. Next, gastric bypass or the removal of a portion of the digestive system. Yes, so you cannot absorb vitamin B12. The same thing with your iron. Next, Diphyllobothrium blatum. Yes. So, it tends to absorb the vitamin B12 instead. Next, class, blind loop syndrome. So, in the blind loop syndrome, there is bacterial overgrowth, which blocks the sites of absorption of our vitamin B12. Galing, no? So, Crohn's disease, gastric bypass, Diphyllobothrium blatum, or fish tapeworm disease or diphyllobothriasis. Kala nyo nagjo-joke lang ako na sinasabi ko yun. Totoo yun. Sa himawan ko pala sinasabi to. Next, blind loop syndrome or bacterial overgrowth. Class, I read that, example, if you are drinking proton pump inhibitors kind of drugs, itong mga PPI na to, it decreases the acidity of the stomach. And so it can promote the growth of bacteria. Next, pernicious anemia. Class, in pernicious anemia, apparently, matindi to. This is an autoimmune disease because the antibodies will attack either your parietal cells or intrinsic factor. So, class, parietal cells are the one that produces an intrinsic factor. So, either it attacks the factory or it attacks the production of intrinsic factor. Ina-attackan niya yung factory ng intrinsic factor which is parietal cells or i-attack niya ng intrinsic factor mismo. Yan. Class, pernicious anemia. The other name of pernicious is dangerous kind of anemia. And it can lead to vitamin B12 deficiency which can result to megaloblastic anemia. Yan. No? Class, akikili lang nitong na to, slide na to, pero sobrang siksik siya at lumalabas to sa board exam. So, class, vitamin B12 has neurological symptoms. Can lead to loss of memory, reflexes, psychosis rin, ganun katindi. Class, mawala ka ng vitamin B12. Ang vitamin B12 class is found in meat products, in eggs, kaya yung mga strict na vegetarians or vegans. Yan, hindi talaga kumakain ng meat. So class, aside from your peripheral blood smear, makakahanap tayo mga Howell Jollies, ganyan. We have special tests. So we have dito tayo, yan, serum cobalamin assay. Yan. So itetest natin. So increase ba or decrease? Next, methylmalonic acid and homocysteine test. So serum test to. Class, ang role ng vitamin B12, it tends to, one of its function is precursor for the creation of thymine. Aside from that, it decreases homocysteine. So pag walang vitamin B12, homocysteine is increasing, tumataas yung amount niya. Yan. So hyperhomocystinuria is actually hyperhomocysteine is actually bad for us. Yan. So expect mataas siya. Vitamin B12. And class, we have Schilling's test. Yan. Dapat pag nabasa nyo ang Schilling's test sa quiz B or sa board exam, dapat yung isip nyo megaloblastic anemia, pernicious, vitamin B12. Yan. So, parang nalulubat na ako. Oh, kasi orange na siya. Wait. Can we pause lang? Okay. So, guys, let's talk about Schilling's test. Actually, Schilling's test is already obsolete, guys. But they still ask this. Yan. Pati in med. So, this one. So, actually, it can take up to 4 days or 3 days. What's good about Schilling's test? It's cheap. What you only need is a radioactive labeled vitamin B12. So usually, it's labeled with cobalt. So yun yung, kailangan mo ng vitamin B12. Yan. Actually, nilagay ko dito, day 1, day 2, but actually it can lead to day 3 and day 4. What's good about Schilling's test is you can identify the reason why there is malabsorption of vitamin B12. So, simulan natin, ha? So, on day 1, so pumunta yung pasyente sa hospital or sa laboratory. A patient is given a radioactive labeled vitamin B12 orally. Yan. And next, after an hour, actually, an unlabeled vitamin B12 is injected intramuscularly after an hour. Bakit ganito? Yan. So the goal of the doctors is they want to saturate all the transcobalamin receptor. Sa lahat ng receptor, gusto lagyan ng sa katawan, lagyan ng radioactive labeled vitamin B12. Guys, binigyan yung pasyente ng unlabeled B12 para, class, hindi pumunta yung radioactive labeled B12 sa liver. And that's the purpose of it. So their goal is the labeled B12 will be secreted in the urine. Yeah. And so 24-hour urine is taken. Class, dito tayo. So I'm going to annotate this one. And sabi niya, if more than 10%, yun yung ina-achieve natin. Either or normal na yun, so stop. Huwag na tayo proceed sa day 2, or there is low intake. So that's why we did Schilling's, because may mga symptoms yung pasyente. Sabihin natin, nakahanap tayong Howell Jolly body. So we're sure that if it's more than 10%, it's only due to dietary reasons. But guys, if it's less than 10%, we need to proceed to day 2. And first one, they have an hypothesis na pernicious anemia. So what they're going to do is, on the second day, is add intrinsic factor. So sa day 2, same procedure, labeled B12 plus intrinsic factor, tapos after 1 hour, give them unlabeled vitamin B12 intramuscularly. Yan. So kung tumaas na yung secretion ng vitamin B12, it's pernicious anemia. So ibig sabihin, there is this malabsorption which is caused by pernicious anemia. But if it's still less than 10%, proceed to day 3. And class, we can test it by using antibiotics. Baka may blind loop syndrome or overgrowth of bacteria. So day 3, pwedeng labeled B12 plus antibiotics. Ganun. Galing. Galing nitong shillings class. Okay? Isa pa. So, ibang color naman. Clear all drawings. Yeah. So, shillings test. So, it's a test of assessing the root cause of vitamin B12 deficiency, if it's malabsorption or dietary intake. So what we do is give orally a patient with COBAD labeled or radio-labeled vitamin B12, and after an hour, we give them unlabeled vitamin B12 intramuscularly. So what the doctors want is they want that the patient will excrete the radio-labeled vitamin B12 to the urine. That's why they give unlabeled B12 so that the radio-labeled B12 will not go to the liver. It will not attach to the liver. So if it's more than 10%, so it's normal. So, okay na yun. So, the only reason is dietary reasons. And just take vitamin B12 supplements. But, if it's less than 10%, we need to proceed to day 2. And so, for day 2, so, aside from the radio-labeled vitamin B12, which is taken orally, we also give intrinsic factor. So, we're trying to correct. Yan. So, kasi diba ang mga tao may pernicious anemia, wala silang, the antibodies, IgA attack the intrinsic factor or parietal cells. Yan. So, kung na-correct at tumaas yung vitamin B12, it's a pernicious anemia. So, ang goal natin, mataas, more than 10%. But if it's less than 10%, yan, proceed to day 3. So, they can give antibiotics if it's blind loop syndrome. Ganun. Galing. Clear all drawings. Yeah. Next is normocytic. Normochromic anemia na tayo, class. Konti na lang tayo. So, notice here in the picture, yan, maganda, maayos ang red blood cell, kompleto, the pallor is not so big, it's small. Normal looking naman ang ating WBC. So first one, guys, is aplastic anemia. Aplastic anemia. So coming from the name aplastic, yan. So actually, there is no production. Aplastic. Actually, dapat hindi niya to anemia eh. Kasi nga, sabi niya, severe reduction of hematopoietic stem cell resulting to pancytopenia. So anemia is the wrong name for it. Dapat aplastic pancytopenia because not only the red blood cells are affected, but all aplastic because there is no production of hematopoietic stem cells. Class myeloid stem cells, wala. Lymphoid stem cells, wala. Erythroid stem cells, kakaunti. Kunti lang lahat. Yan. The bone marrow is hypocellular. Ito yung pinaka-stand out, class, sa aplastic anemia. Because I told you, all of the anemia, bone marrow biopsy is not really used unless it's leukemia. But here in aplastic leukemia, anemia, class hypocellular. So, naiiba siya sa leukemia, naiiba siya sa myelodysplastic syndrome. It's hypocellular. Basically, your bone marrow has failed you. And bone marrow failure. Class, the MCV, sabi niya, is normal to slightly increase daw because some of the premature cells, blasts, are released in the circulation kasi walang production eh. So, sabi niya, number 1, idiopathic aplastic anemia is the most common. So, idiopathic. Yan. So, unknown cause. Yan. May narinig ako, sabi na, idiopathic, it's the pathology of idiots. Kasi we don't know what's happening. Yan, joke lang yun, class. Pero, Idiopathic, unknown etiology. So, hindi natin alam. Yun yung mas common. Next class, acquired aplastic anemia can be due to viruses, parva B19. Class ito, ang parva B19 nagkaklos siya ng anemia. And constitutional aplastic anemia. So when we say constitutional, it happens for a long period and a slow period of time. We have Fanconi's anemia. Yan. Cooley's anemia. Ano yun? Beta thalassemia. Fanconi's anemia is actually aplastic anemia. And actually, nakakaawa itong mga to. It's terrible because it's congenital and the person has no red cells, has no WBC, so they are very prone to infection, to bruising, to bleeding. Class D, in your notes, it's hyperpigmentation. But here, I found it can be cafe au lait spots. And cafe au lait spots or hyperpigmented and pigmentation on the skin, short stature, maliliit. Yan, Fanconi's anemia, aplastic anemia. And class, ayun, just like any anemia, it has fatigue, headache, angina, murmur, infections because pancytopenia mga kapatid, and petechiae purpura ecchymosis, so mucosal bleeding due to thrombocytopenia. Again. Okay ba tayo? So, aplastic anemia, so there is no development, there's no maturation of your hematopoietic stem cells. Basically, there is bone marrow failure. Yan. So, yan isang highlightan dyan, Fanconi's anemia. Cafe au lait spots. I love it. Yeah. Next class is pure red cell aplasia. So, the difference between aplastic anemia, it only affects your red cells. Pure na eh. So, pure red cell aplasia, there's no growth among the red cell line or the erythroid line. So, expect class na may anemia, reticulocytopenia. How can you make red blood cells? Diba? Wala kang reticulocytes, decrease erythroid precursors. Yeah? Wala. Pure red cell aplasia. So among people with PRCA, pure red cell aplasia, it can be transient. So this can happen for a short period of time. Example, during childhood, transient erythroblastopenia of childhood. Di ba sa Baguio sa mga transient? Plus walang transient na nagtatagal. And transient aplastic crisis, specifically parvovirus B19, paki-highlightan yun ha. Transient aplastic crisis. Next class, when we talk about something that is hereditary or congenital, so Diamond-Blackfan syndrome. Yan lang mga memories nyo, Diamond-Blackfan syndrome, parvo B19, no pancytopenia, only red cells, and acquired, pag sanabi natin acquired, pure red cell aplasia, acquired, so parang external causes, pwedeng chemotherapy, it can lead to thymoma, so tumor of the thymus. Diba thymus is the site where your T cell develops and matures. Okay ba tayo, class? So, yung mga normocytic, normochromic, we have aplastic anemia, pure red cell aplasia, last na. Konti na lang. So, we have myeloproliferative anemia. So, matindi to rin tong myeloproliferative anemia. Class, if we will just review your myelofibrosis, I told you there is increased connective tissues in your bone marrow. That's why it can result to teardrop cell. Class, ito rin, myeloproliferative anemia. In your bone marrow, there is the infiltration of abnormal tissues. Infiltration of tissues. Anong tissues yun? Cancer. Multiple myeloma, plasma cells can go inside your bone marrow. So they can accumulate in such a way that these tissues will outgrow or replace the tissues in the bone marrow. So yan. Myeloproliferative anemia can also result to pancytopenia and teardrop cells. Since your red blood cells are squeezed out of the bone marrow, yun, teardrop cell. We have anemia of systemic orders, yan, bisahin nyo lang yan, and congenital erythropoietic anemia. Class, underline doon yung HEMPAS. Yan, HEMPAS. So, it talks about congenital dyserythropoietic anemia. Last na. Yan. Hemolytic anemia. That's when hemolytic anemia. So, usually, yung may mga hemolytic anemia, pwedeng pag in-extracan mo sila, automatic-lysed na yung plasma. Yan. And it's normocytic and normochromic. So, normal pa rin yung size, normal pa rin yung hemoglobin. The laboratory findings. Class, ito yung gusto kong i-memorize nyo sa hemolytic anemia. So, expect increased reticulocyte and reticulocyte production index, decrease hemoglobin hematocrit, just like any other anemia, decrease myeloid erythroid ratio kasi mas mataas ang erythroid. Chemistry, class. So, since there is increased breakdown of red blood cell, so, ikina-convert siya sa unconjugated bilirubin, mataas po. So, if you have pernicious anemia, hemolytic anemia class, lactate dehydrogenase, LDH is found inside your red blood cell. So, if there is increased hemolysis, methemolbumin, yan. Pakibasa na sa notes niya yan. And decreased in haptoglobin. So, haptoglobin is the carrier of free hemoglobin. Yan. Decreased siya. Because it carries your hemoglobin. So, dapat decrease free haptoglobin. Urinalysis, hemoglobinuria, and methemoglobinuria. So, that's your chemistry. So, siguro po highlight in class yung unconjugated bilirubin. Pakisulat unconjugated and lactate dehydrogenase. Haptoglobin decrease. Yan. In hemolytic anemia. Yan. That's, I made this table kasi ito lang yung i-discuss ko for hemolytic anemia. I want to summarize it for you. Ayoko na kayong guluhin. But class, simple lang pero malaman. Ready ko lang itong mga box ko. Okay. So we have hemolytic anemia. I separated it into intrinsic and extrinsic defect. So when we say intrinsic, nasa notes nyo, intracorpuscular. So there is something wrong inside your red blood cell. Sa loob ng red blood cell mismo. Ano ba ang laman ng mga red blood cell? May membrane, diba? May membrane naman ng red blood cell. Diba? It contains of cholesterol, proteins, lipids, carbohydrates, may enzymes, di ba? In heme synthesis. Yan. May hemoglobin. Those are the intrinsic effects. There's something wrong inside the red blood cell mismo. That's why there is premature breakdown of your red blood cell. So let's start with hereditary spherocytosis. If I'm not mistaken, ang tatlong mali dito is spectrin, ankyrin, and BAN 4.1. It's in your notes. So it increases, those membrane defects increases the risk of hemolytic anemia in hereditary spherocytosis. And we also have hereditary elliptocytosis. In elliptocytosis, I think protein BAN 4.1. Yeah. Next, enzymopathies. Class, the absence of these three enzymes will increase the risk of being broken down by the spleen. So, ang first na pinaka-common na enzyme deficiency or enzyme defect is G6PD deficiency. Top 2, pyruvate kinase. Yan. Dalawa lang yung nasa notes nyo. But lagyan mo na ng fifth, pyrimidine 5 nucleotidase. Yan. Yung top 3 yan, those 3 which will be absent can result to hemolytic anemia. Class, I think, highlight ko na to, si G6PD. So, G6PD, is important so that your hemoglobin will not be oxidized. So, makakakita tayo ng Heinz body sa G6PD. Next, hemoglobinopathy. So, example, having sickle cell anemia. So, there's the replacement between valine and glutamine. Ayan. So your red blood cells um, tends to be prone to breakdown. Sickle cell, di ba? Yung parang banana shape or crescent moon shape. Yan. Tapos na ang intrinsic defect. Yan. Classical cell anemia can result to, nasa notes nyo leg ulcers, yan, sugat sa paa. Ba't kaya? Because of necrosis, sometimes your sickle cell, when there is decreased oxygen, it hardens. So if you have sickle cell anemia, if there is decreased oxygen, your hemoglobin S tends to harden. It forms tactoid crystals, and these tactoid crystals can occlude or block the passages in your capillaries, especially on your feet. Ganyan. So if it will block the capillaries in your feet, so it can lead to the lack of oxygen in that area. So ano bang effect nun? Hypoxia, tapos necrosis, sugat. And leg ulcers in sickle cell anemia. So kakalimutan yan. So if there is sickle cell crisis, there is decreased oxygen tension in the blood, wherein there is excess formation of tactoid crystals from your hemoglobin S. Okay, next, extrinsic defect. So extrinsic defect or extracorpuscular defect. So this is not, so the reason for this are not due to your red blood cell, but other reasons. Dito muna tayo sa MAHA, DIC, and PTP. So class, these three diseases, isn't it that there is excess thrombosis, there is excess clot formation. So these clots in your blood vessels tends to form and tends to crush or destroy or break down your red blood cells. Ganyan. Nasisira yung mga red blood cells due to this excessive clotting in the blood vessels. Next class, mechanical injury. So example, heart valves. So sometimes the heart valves, especially if it's old, it tends to harden. Yan. So once your red blood cell passes through the valves, this valve actually prematurely breaks your red blood cell. Nasisira niya ang titigas ng valves So dumadaan dun yung red blood cells, nasisira yung mga red blood cells. So yan, naglalais na yung mga red blood cells. Infection, thermal injury due to heat, excessive heat. Yan, nasisira yung mga red blood cells. Next class, we have complement. So complement are series of proteins. So nasa immunosera to. I don't want to get into that. So if ang goal ng complement is it gets to be activated and wants to result to cell lysis. So class, pag ang complement ang tinarget niya red blood cell, it can lead to hemolysis. So one disease is paroxysmal nocturnal hemoglobinuria. So paroxysmal nocturnal, so sa gabi, when the body tends to be more acidic, yan, there is increased breakdown of your red blood cell. Kaya pag gising usually ng mga taong may PNH, hemoglobinuria, nagigising sila, their urine has blood tinge, ganyan, dark colored urine during the night. Yan, paroxysmal nocturnal hemoglobinuria. So so there is activation of lysis during the night. Ganon, class. So, tinatanong actually ito sa board exam. May gusto favorite nila to PNH. So, yun, please pakibasa yung Ham's acid test, yan, sugars test, mga ganyan, mga test for PNH. Next class, finally, another reason that causes hemolytic anemias are antibodies. Diba? May antibodies natin, gamed, IgG, IgA, IgM, IgE, IgD. So, pag sinabi natin warm antibody autoimmune hemolytic anemia, and I think this is very much dangerous. Kasi it happens at body temperature. So, ibig sabihin sa loob ng katawan, your IgG is activated because it's a warm antibody. Your IgG is very much dangerous kasi it can lyse your cells inside the body kasi body temperature So, yun. So your IgGs attach to your antibodies and activate lysis, complement, activation, ganyan, and it will break down your cells. Ito class called antibody autoimmune hemolytic anemia. So I think unless your body becomes very cold, you will be hypothermic, or you will, kunyari, kunyari specimen, you will extract blood from the patient. Pagkalabas ng blood class, doon lang siya maglalais kasi it was exposed to a cold environment. Yan, cold antibody autoimmune hemolytic anemia. And class, this one, paroxysmal cold hemoglobinuria. Yan, cold siya. So therefore, it's IgM. So it's the IgM is donor Landsteiner antibody. So this promotes the lysis of your red blood cells. Yan. So, simple lang tayo, class. So, I will give you a series of quizzes. So, for the topics that I've discussed, and I hope you will read them well. Yan. So, my last. So, 2020 may have thrown more at you than you planned, but you still made it. Hematology ends here. Congrats, guys. So, I'll see you soon. Bye-bye.